Good morning, doctor.
Good morning, Pillai. I'm not able to hear you. I don't know why. Okay, yes. I'm not hearing you. No, I think, is it my problem? Second, can you please speak up?
Good morning, doctor.
Okay, my problem. No. It's a Pillai problem. Pillai problem. It's not my problem. Bala, can you speak up?
Yeah. Good morning, doctor. How are you?
I'm doing good. Yes. Pillai, your voice is a little lesser. I think you have changed your headphone.
Okay, doctor. Let me.
Now it's okay.
Okay, doctor.
It's fine. Yes. Bala Pillai, without taking much time,
direct to the conversation. I believe both of you are good. Shashi Kumar informed me he is absent today. Yes. Both are you good, right? Both are
Yes,
good.
yes, doctor. Yeah, good.
And yesterday I remembered both of you and three of you because I met one of the person from Ajman and who have been invited to my home yesterday for iftar. And actually he's doing something triple E, electrical engineering, something related, where major customers are ADNOC and many other things. They're based on Ajman, but I was feeling like wondering even how ADNOC and Shell and BP, something very leading companies, are depending this Ajman based is not a very small based company, is a Malayali, is a owner. They are giving some sort of power supply or something like that. Whenever a new project comes, they'll be providing the power related things, electrical things and data center or something like that they mentioned. So I was thinking like people from India, basically, they're doing a good job in UAE in terms of engineering and petroleum, many other areas. That is unexplored area, I believe. Not explored area for your cases. For me, it was yesterday I realized the people are doing a good job. These three people of the honors are working in some of the companies in Abu Dhabi or something. During COVID-19, it has been dispersed. I mean, the number of people have been fired out. Then these three people have formed it, and he was telling me like for one project, very minor project, the company will be getting 2 million, 3 million profit even minimum. So I was thinking how well they are doing in terms of these areas. Then I remembered you people.
Yeah, they may be subcontracting some of the local agents. So ADNOC actually they are looking for in-country values, ICV, in-country value. So any local agent, they will subcontract the technocrats for executing the projects, small projects. Yeah.
Okay, great. Okay, now what my intention is, I want to get the Bala's work to be shared here and the Pillay's work finalized. And already you have shared me the work, an updated one. It's very detailed proposal. Now, Bala, now we are confirming the changes in your work. Bala, are you able to share your work here, if possible? Bala is not here.
I will log in. I will log in with my.
Okay. If you can share it, now itself we can confirm your proposal and the changes required. Then you can start working on the thesis without wasting much more time.
Yeah, sure, doctor. Just give me 1 minute. I will log in.
Bala, you remember, Pillai, you remember, I shared you one paper to you, right?
Yes,
Recently.
doctor. I saw that. Yeah, the book.
Yeah, it has been published in
paper.
that article.
Yeah, very good. Yes, sir. Yes, doctor.
I will be sharing you just a second. The paper is only for starting. I want to share you the work. 1 second. Where it is. No, I'm not able to see. Now, the work that I have shared, it has been published in one of the international journals. I told you one journal is the IOSR, JPM.
Yes, doctor.
It's a peer-reviewed journal, and even you can publish it as a beginner. Okay, so I was having some gap of research publication, so I started publishing that one. So I strongly recommend everyone to publish in the Scopus Index publication. It's very important to publish to authenticate your works of PhD. Now you can start publishing in some of the journals like IOSR, JBM. It requires a lesser amount to publish. Okay. Meanwhile, Pillai,
Yes,
you
doctor.
can start working on completing your first honors, your literature review chapter and introduction chapter, the both chapter. Ami, It's after a long time.
Pleasant morning, Doc. Pleasant morning, everyone.
Good morning. How are you?
Always good. Always good, Dr. Pillay.
No, Ami is not hearing me. Ami simply skipped my words.
Morning, Doc. Good morning, Doc.
Yes. Good morning. Good morning. Yeah. Were you the previous weeks? That one, Ami didn't hear me. Research proposal, Ami.
Yeah.
Yes, Ami. Yes. Let me take. Enhance in the ambulance delivery through strategic healthcare system integration and collaboration efforts in UAE.
Yes, Doctor. That's my title for my dissertation.
Okay.
Yes, Doctor. Can I share?
Yeah, sure. You can share.
Are you able to see my screen? Are you able
Okay.
to see?
Yeah,
Okay.
I can see. Or let me try to take it from your work then. Bala has shared to me directly. Research proposal, Bala. Okay, Bala, I'm sharing here. You can stop sharing then. 1 second.
Okay.
So
Okay.
conveniently, I can use to share you, right? That's good, I believe.
Okay.
Pili, are you able to see this?
Yes, doctor. Now.
Yes.
Yes.
Yes,
Yes.
Doctor.
Okay. What I'm going to do is very small discussion on Bala's work, in which you can make the necessary changes on your research proposal. Then we have to start going for. Also send me the work, okay? After the finalized work, this one research proposal, we need a smaller changes in your topic. Water management with the growing population in the UAE. Water management can be understand a general study on the water management you're doing and what is the importance, how we can tackle the issues, the growing population in the UAE. Just find out some of a very similar topic or rephrase it, paraphrase it, work on your title. I hope Bala got it, the meaning behind it. Bala, what has to do is the topic need some changes with the same meaning.
Okay.
Maybe it's a grammatical mistake. When somebody is reading, I don't feel good. Water management with the growing population in the UAE. Maybe you just try to find out a number of topics from, then
Sure.
finalize it.
Yeah. Okay.
Okay. So abstract and reduction context is fine. Research problem is also okay, because you are identified the current inability of the water management practices to meet the increasing demand of the growing population in the UAE. So research problem illustration, increased demand for water, current water supply mechanism, etc. So your research objectives are to assess the current state of water management practices in the UAE. That is okay. To understand the relationship between the UAE's growing population and water demand. To evaluate innovative technologies and methods in the water conservation, to recommend strategies for improving the sustainable water resources in the UAE. How does growing population? What are the current management strategies? What role do technology or desalination management practices can be enhanced? Okay, so I wanted to know with a Pillai, how Pillai is going to collect the data, from where, from whom, and who is your target target audience?
I mean, you're asking me?
Yeah.
Okay. Actually, now in the Transco, that is ADDC, I can say, it's mainly for Abu Dhabi region, not for Dubai or other Emirates. Mainly, we are going to focus in Abu Dhabi area. So the website itself has all the data available.
Okay.
In addition to that, probably I can get data from some of our friends by knowing their what is that the ADDC number. So 1 year, past 1 year, 2 years, what is the consumption, how the pattern is, something like that.
Okay. So what I want to tell, you are also measuring the consumption pattern, and you're also suggesting to the UAE what are the strategies to improve the water management. So basically, you will be getting the data from people from the company and the people like us. You also wanted to check our conception also, right? So you'll be preparing some questionnaire for.
Yeah.
Okay, so that is a major one, how the consumption pattern, and okay, we'll be looking into later. Consumption pattern, other things we'll be looking into from the checking. Okay, so but in the literature review structure, it's entirely different thing that you have added. I don't know whether it's a mistake or not, because you are checking the organizational culture and employee psychological well-being. Are you able to see? And a literature review chapter should be something different, yeah? We must be having literatures into that. What are the literatures presently available, which mentions about water management anyway, water management international level, and is there any other studies done in the field of water management, etc. Bala is following me?
Yeah.
What I want to tell you, the literatures in the field of water management should be included in your studies. So that you have to refer. I have shown you some papers, right, in the class. So if you refer some papers, you can easily see under the literature review what they done. Specifically taking the research questions and objective, they are trying to understand what are the areas of the literatures that are available, which speaks almost related to your research questions and research topic. Okay, so you need to recorrect the literature review on the basis of your topic. Okay, and the fifth one, methodology and data collection. We need some more details in that. Pragmatic research, that's fine. Pragmatic research, absolutely, you have written the correct, because you are using the both. Where existing theories in water management population, that's all okay. Research strategy, will case study analysis to examine. It's not a case study analysis, because research strategy, yeah, you expert interviews will be conducting. Yes, that is fine. Then okay, case study analysis, fine, we can keep it up then. Time horizon, cross-sectional time horizon, collection data over the period of 6 months to provide a snapshot of the current state of the water in the UAE. No, time horizon, the data collection, your, okay, 6-month time period you are taking, how the consumptions and all.
Yeah.
Okay.
Or even more, I can.
More number of years you need to take.
Yeah.
because
Okay.
then only you'll be able to analyze properly.
Okay.
And data collection method, quantity data, population growth, projection, current water level will be gathered from the government, industry, export. Also, your data collection, quantity data, also from the people, customers, the people like us. That's a
Yeah.
major area.
Okay.
And quality data, that's fine. Quality data, okay, you can, it's good. Ethical consideration, limitations. And these are the things that you mentioned. Other than this, for your little bit detailed way of research proposal is, I appreciate, because your research methodology part also need a little bit more, because what type of sampling method you're following, random sampling, snowball sampling, or there are a number of sampling method we discussed in the class.
Mhm.
Which area you're focusing mainly, the entire UAE. For example, you want to collect the data from the different emirates, that's also good. It will authenticate your study. Or for example, 100 members or 200 members, people from the different areas. It's up to you, 50, 50, 50, 50 different emirates. Something like that. Then it will be showing, okay, you're covering the entire UAE or something good. Or Abu Dhabi, it's fine, Abu Dhabi, no problem. It's up to you. You can focus on Abu Dhabi. The people residing in Abu Dhabi, you can take the collection of data from them.
Okay.
So what I want to tell, something very detailed approach you have to follow, particularly in the literature review chapter. You need to change entirely what all you have written, organizational well-being and etc., because it's something very different, contradictory.
Mm.
Then research questions and objective. One more thing that you need to add. Once you are collecting the data from the people like us, what exactly you wanted to analyze? You wanted to analyze the relationship between anything.
What what is the consumption pattern? For example,
Okay.
it is in general, the per capita is normally mentioned as let's say 300 to 350 liters per person. But in Middle East, especially in UAE, the consumption pattern is so high. It goes over 550 liters per person. So what are the ways? So kind of an education to educate people or to limit the we will give ideas like uh, how to minimize the usage of water, how to conserve water, and in
Okay.
case
My question is, yes, I got it. Or you will be doing all these aspects, pattern, consumption patterns and all. By my next question, since it's a thesis, the bigger studies, you can also do some sort of an analysis. Already you are collecting the data from the people. Why can't you collect more data from them? Like the commitments area, or it's like their usage and their intentions. There are certain people, they are very, I have an intention to reduce the water supply in my home. It's not happening everywhere, right? So because we are getting a very lesser water charge, so we are not that much committed to reduce this water consumption. Sometimes it happens. So you can also prepare a questionnaire, something like that also. Or one of the question can be, or research objective can be to analyze, to investigate people conception.
Are you able to hear me well?
yeah.
Awesome.
Oh, my earphone then. Okay. You people consumptions and think of it. You think of it. You understood what I meant, right? You wanted to analyze the people consumption and its relationship between their intentions to reduce it, their intentions to, or, while we are using, sometime I may feel, the government is giving me a very lowest price of water supply. So why can't I reduce it? A kind of a commitment is there or not? The people are having. So whenever we are preparing a questionnaire, something like that, we can prepare, I can help you to prepare the questions, something like that. So you need to address that in your research objective. Later, we can change the questionnaire as per our demand and needs. You can just mention to analyze to investigate the people responses towards the conception, commitment, and intention to use the water or something like that. Okay, just remember, you make yourself one question, then we can write whatever in the later stage. Okay, so these things you have to make the analysis, etc. Okay, done with. Now the Bala is done with. Now I'm going to, and you are
and also not only the individuals, our target is mainly on the industries as well. So what are all
okay.
Right.
So, because industries, they should not be, they should not take it for granted, and they should not waste.
Please mention that is from the industry industry people that already you mentioned. The you can also mention the people like us also, consumer.
Right.
So whenever you are doing data analysis, you will have to do the 3 areas. First one, focus interviews. That is from the government employees. I mean, the people who are working in the sector. And the second one, industry. Third one, the people like us. So your studies is having more significance then. Otherwise, significance will be reduced. So there may be some studies already be done from the industry only, but you are taking the 3 elements. So there will be a research gap. That's also you need to mention in your research proposal. What is your research gap under the literature review? Okay, done with. Now, next I'm going to Ami's work. Ami here?
Yes, doctor. Yes.
I'm having the problem with Ami's work, only one area. Ami proposal. Are you able to see, Ami?
Not yet, doctor.
Not a doctor. Okay. I'm getting stuck in better way. Now are you able to see?
Not yet. Still not. Yes. Yes, doctor. It's not. Yes, doctor. Showing already.
Okay, now you can see, right? Take some time for
Yes.
me right now because I have opened a lot of files. Screen is sharing, perfect.
Yes, doctor.
Okay, enhancing the ambulance delivery through strategic healthcare system integration and the collaboration efforts in UAE. Only this word.
Collaboration, doctor. Yes.
Yeah, because the topic is really good. I understood you're from that area. You're doing the same research. It can contribute to very good things. Enhancing the ambulance delivery through strategic healthcare system integration and collaboration efforts in UAE. Instead of, we can mention enhancing the ambulance delivery through strategic healthcare system integration in UAE.
Yes, doctor.
But you also collaboration efforts, think of that area, any words you can replace, or you can remove that area, a collaboration effort, because already you mentioned in your research objective the same collaboration efforts. So no problem. So think of it and enhancing the ambulance delivery through strategic healthcare system integration. STD in UAE or something like so you have to make your topic more wider. Then later you can include many things in your research. If you're making your research topic little confined, the problem, later you cannot add anything.
Yes, doctor. Understand.
Okay, you understand, right? So it's fine. Topic is good. The word healthcare system integration also good. And Go through the word healthcare system integration in detail. Is there any research topics are there, research titles are there, and anybody has done the same topic? Then you can confirm, yeah, healthcare system integration, the word is there in the market. Yeah, the people are using.
Yes.
You have to make sure from literatures. It's fine. Your structure is fine. And Bala, you also make sure your table of content in your work. And the introduction, I've gone through introductions and all context already. Research problem is fine. And this one, you need to response time of what is the level of ambulance service level? Okay. Okay, you have given in detail what is the extent of strategy healthcare system integration in terms of appropriate. Okay, then it's fine. Research objective, current state of delivery to external healthcare system integration to evaluate the effectiveness of collaboration efforts. Very good. To investigate the relation between service delivery, integration, and collaboration. This one only I have a problem. To investigate the relationship between service delivery and integration collaboration. What do you mean by that? Investigate the relationship between service delivery. That is good. That's a good word. People are
Yes.
mostly doing that. And what? What integration? What do you mean by integration here?
The integrations between the hospital and the uh, non-hospital settings, which is the ambulance through to the hospital settings, doctor.
So
Because
how you are going to analyze it? Can you please tell me how you are going to
that
receive the data for this?
pertaining to the data, doctor, it will be the factors are the response times coming from the once the ambulance responded on the certain locations, then from that locations going to the hospital itself to the definitive treatment, which is the
Very
hospital.
good.
So the time itself, okay, the response times, and then the time endorsing the patient to the hospital, and how and what is the quality of endorsing it to the
Okay.
hospital
So
itself.
you wanted to measure anything from the people like us, which means the patient.
From the patient itself, doctor, it would be it gonna be a survey feedback in terms of the delivery system itself. So
Yes, good.
the collaborations from the client itself to the responding participants like the EMTs, paramedics, as well as to the receiving parties at the end, which is the nurses and the doctors in the
Very good.
hospitals, plus the feedback from the client itself, which is the center of their care. So that is one way of and trying to investigate the quality of rendering of care from the
Okay,
out
very
of
good.
hospital settings to the inside the hospital settings, though,
Very good,
to
very good,
provide
very
that
good,
kind of
very good.
feedback.
So you the fifth one you can write separately, the two-way, to identify the challenges and issues or related to healthcare system. And the sixth one can be you wanted to provide a formulated recommendations to improve the system, yeah, or something to support the system. Your literature review is
It will
good.
be, doctor.
Yes, yes. Yeah, Bala, are you able to see literature review here? Bala here? No.
Yes, doctor. Yeah.
Okay, but Bala, you can see the literature review, how the army has written. This way also you can follow. Is also okay. Because he has taken the major variables of his study. Ambulance service delivery. He has written some of the works from others, who are the people I've mentioned. Healthcare system integration ambulance services. And the role of collaboration in the ambulance delivery is good. Problem encountered by the ambulance operator. Strategic integration collaborations. You know, what he was trying to communicate is like, these are the elements already discussed by the people, so my study is having importance. Okay. Then you can also provide Ami a research gap. Okay, research
Okay,
gap you can
doctor.
mention, because already you written
Yes.
the things. You can also mention research gap.
Yes, doctor.
This one I suggest you. It's
Doctor, the
good that you,
conceptual framework is just like I copied it from my previous dissertation paper in my master. I don't have any other
No problem, no problem. It's good.
The framework is
No, process, we are not doing any kind of regressions and all here. Process, input, process, no. Conceptual framework, which means you're checking the ambulance service delivery, strategy, healthcare system integration, collaboration efforts, challenges encoded by ambulance operators. Output is enhanced integration and collaboration in the ambulance services, and patient satisfaction also you can mention if you want to mention.
yes, doctor. Yes, doctor.
Next
That
one will
would
be
be
good.
included in that one.
Okay. Process, discrete strategy, correlation analysis, regression interviews, and focus group discussion, thematic analysis. Okay, you can keep now this one over here. What you wanted to communicate, you're having some input data and you're having some output. What you're going to do to process all these things to the survey, discrete statistics, correlation, regression. You can also mention ANOVA, some things, yeah. ANOVA also you can mention ANOVA, ANOVA. Okay, regression coefficient. Yes, fine. There are a number of reliability tests that everything you know, you don't need to write it. That's fine. It's fine for a time being. Is fine. Then methodology and data collection. Pragmatic research, multi-mixed method research approach, quantitative.
It will be, doctor, a mixed method approach, doctor,
Okay.
because the answering questions in terms of experiences, both from the nurses, decision makers inside the hospital, and the EMTs and paramedics of the ambulances.
Okay. Okay. So your study has been come up. This is one of the format I shared to you. You have added it. What is this? Culture of wellness.
I take it, doctor, as from the samples itself.
No, the copy that is about that study.
Yes, doctor. Holistic, the integrations, the using the Blue Cross approach.
No, this one is directly you have taken that work.
Yes, doctor.
No, don't never take it. Never take it.
Okay.
Because actually, why I ask you to write the reflection, that's only an optional one. Even if you're not writing, it's not a problem. Smart reflection is all specific. S stand for specific. How your study is specific. Because you're mentioning my study is specific because I'm just focusing this area, ambulance services. I want to check it on the enhancing, better outcome, the patient's satisfaction. And measurable, M. Smart, second letter is M. Why M? Why M? What is a measurement? How you're going to measure? Because you are going to measure with the feedback, survey, focus interviews, and etc. And smart, A, whether it's achievable or not, whether your study is achievable or not. Yes, obviously, because you are doing number of studies, your response data collections and everything. R means realistic. Your study is realistic. There are a number of studies people are doing. NASA, after reaching NASA and moon, what will happen? No, it's not possible for the people like us. So it's not realistic. For your study, realistic because you're working there and you have an experiences, you have the people in your contact, the people like us who are patients who are using the ambulance and etc. So it is achievable also. And finally, smart, T. T is timeline. Obviously, you're having 1 or 1.5, 2 years ahead or 1 year ahead. You will be doing within which you can collect the data, you can complete the work, no problem. That is a smart reflection. So even if you're not adding, no problem.
Okay, doctor. Well noted, doctor.
So your studies are fine. Only these are the major changes you need to apply with.
Okay, doctor.
Okay, and just bring the logo of the university. Okay, that was so good.
Okay, doctor.
That's fine. Now I'm coming to Pillai.
Yes, doctor.
Pillai here.
Yes, I'm there.
Pillai's work. Can I take it?
You told me to start working on the introduction and literature review. Just I want to know, as out of curiosity, whether my research proposal has been approved by the university, doctor.
Not yet.
Okay.
One second, Pillai. What is the research proposal? 1 second, Billy. I'm just taking.
It's okay.
Because I have opened a lot of files. That's why it takes time.
No
I
problem.
believe this will be the work of Pillai. Research proposal, Pillai, yes. Okay. When I changed it, what is happening? So this is the work of Pillai. Abstract. Your topic itself, navigating the global energy transition. Challenges and opportunity for oil and gas sector in Middle East. No more changes in the topic. Introduction, you have written research objectives, you have written transforming in the energy sector, assessing the anticipated changes over the next 25 years, evolving energy mix, role of oil and gas industries, very good. Policy interventions, recommended energy transition policies, socio-economic implications, sustainability. I have opened it only to recollect everything before I'm discussing the new chapters. For Pillai's work, I have what I have received from academic administration, because we wanted to check the research proposal model is fine or not. So they have checked it. I forgot in between. Our academic administration team sent your model to the team we are contacting. So your way of writing is fine. They mention it. So final, whether research proposal accepted or not, you will be getting very soon. Because I'm waiting for at least 3 or 4 people research proposal to send it. That's why. So now Ami's work is almost done. Bala's work is almost done. I'm waiting for Shashikumar works. Then once I got these works, I'll be sharing the work immediately. Will you share me at the earliest possible if you have a time? Then we can finalize research proposal. That's fine. Now, what I want to discuss with you, I believe you can see me.
Yes, doctor. Yeah.
Now, a detailed literature review chapter is required.
I'll do it.
Okay, introduction chapter we can do last moment after completing everything. Introduction chapter we'll be writing only after that. Starting from a literature review chapter. What all things we will have to cover? Can anybody tell me what all the things we will have to cover in literature review chapter?
Relevant to the similar idea of the paper.
Similar idea?
Similar topic relevant to our paper. And
Okay.
introduction, conceptual or theoretical framework, review of research organized by the teams, identification of research gaps from the literature review.
Okay. Anything else? Can you please tell me in relation to your topic?
Yeah. So, for example, in my work literature review, as I mentioned, in my research proposal, I would have discussed about the particular paper, the introduction, what the framework, conceptual theoretical framework they followed in this paper. Then the review of research, the same literature, and what is the gap in that particular literature.
Okay.
That's what I have captured in my literature review.
Okay, so for your study, you can provide to everyone's study. Okay, now we are going to start with our second chapter. You can provide firstly an introduction. Firstly, an introduction. It also discussing what you mean by literature review and what is the structure of your chapter. A chapter means this particular chapter, literature review chapter, and what all are the key themes that you are going to discuss in this chapter. That's all about under the introduction. I'm talking about literature review chapter. Firstly, provide a small introduction under which we are going to discuss what you mean by literature review and what is meant by your literature review, particularly on your topic, what is the structure of your chapter, what is the outline, the key themes in your particular chapter. That's all about. Then secondly, you are going to bring theoretical framework. What I mean by theoretical framework is all about relevant theories that underpinning your research. Are you following me?
Yes, sir. So
Relevant
any,
theory.
Yes, doctor.
uh,
Yes, doctor.
It can be any theory related to your topic. For example, army topic, healthcare integration. What are the theories are there for the system integrations? It is not directly to the health, not a problem. You're talking about, whenever someone change management, we're talking about anything in the change related studies. We are writing change management strategies that we have discussed. Cotter's change management model, 8 steps we'll be writing. Potter's 5 force model under the strategic management competitions. So likewise, number of theories related to your topic, you can write it. Even the table or format, you can bring it. Some of the any conceptual framework for the theory also you can bring, no problem. So how these theories relate to your research also you can mention under the theoretical framework. And the third one, you can also mention the present theories, any kind of limitations or something, you can also mention, that's up to you. Now we have written small introduction, second one, theoretical review, theoretical framework.
Framework.
Third one is conceptual framework. The first one is introduction. Second one is theoretical framework. Third one is your conceptual framework. What do you mean by conceptual framework? You remember in Army that he has brought a small conceptual framework. The first area is
Yes.
independent or dependent,
Mhm.
independent variable. Last one is dependent variable. We are mentioning the same. What all the variables we are having. And these variable, how we are going to check with the final outcome. Then once we are having able to frame a conceptual framework, that is really good. For every study, we'll be having a conceptual framework. But you try to make a conceptual framework, Bala also make a conceptual framework you are studying. Then how these factors relate with your study. For Pillay cases, you're navigating energy transition. What are the factors, variables are there in the energy transitions? These variables, how this related to your topics? That same way you have to explain it. These are all about under the conceptual framework. Each variables in your study, you're going to explain under the third category, that's the conceptual framework. Now, you are reviewing number of key literatures, which means the fourth one is reviewing key literatures. You are taking number of studies, many number of studies. There you are taking a topic specific review, which means you are taking your major area of your study, oil transition. And second one, decarbonized air landscape, and different parameter you are taking. Then you are taking the particular literature from this. Okay, and how these literatures are relating to your study, how these literatures contradicting your study. That's both you can do.
Understand. So no need to mention each literature separately. We will mention each topic, then we will collect from all the literature.
Absolutely. Under which you can also write what is the findings of the particular literatures. Obviously, you will be writing the findings, no doubt. This way you have to write. Then it's fine all about empirical studies also. I mentioned about review of key literature. Under the key literature, you are taking the literature, theoretical literature. Some studies are there, theoretical paper, right? Some studies are there, They are collecting the data from the people. They are going through the quantitative data analysis. Such kind of papers are that we call empirical studies. Okay, that also separately you can provide. Army's number of papers are healthcare system, number of theoretical papers are available. In addition to that, empirical papers are also available. Empirical means what you're going to do. Once you've completed your work, thesis, many other researchers may use your study as a empirical study because you are collecting the data and finding and trying to investigate something. That's why. Okay, then literature review, major. Another point is research gap. And you have to provide a justification for that. Because you've done number of literatures, collection, identified it, then you reviewed it, you analyzed it. Finally, you're going to tell a research gap. This is my research gap. Then you are going to provide a summary and conclusion. That's all about for your literature review.
Okay.
Spend your time on this. We need a very, very good literature review chapter. This is an essence and the pillar of your entire study.
Understood,
Okay.
Doctor.
This one I wanted to communicate with you today. Now, others who can work on the research proposal, send me. The next one, literature review chapter, work on it. Take your time, work on it, because literatures, now we are having a number of tools. I cannot directly tell you to use it, but people are using, and which are really helping you. What is SEI space, SSEI space? That is a new one. I recently taken one of the screenshot of once again, let me check it out. Yeah, yes. Tool for literature. There are a number of SCI space. Space means letter itself, SPACE. Because if you're going there, you will be able to find out the literatures available in your field. You don't have to go for a different spaces, no need of it. So they will be giving you, these are the literatures under your work. They will be helping you to find out your research gap even. There are a number of things are there for literature review. I didn't work it yet. You can do your work. Just try it. Research Rabbit is the Research Rabbit. You can also search in the connected papers. There is a one, connected papers. There is another one, Elicit, ELICIT. Just try this SCI space may be very helpful for you, and Research Rabbit is more than enough, I believe. But try to other one also. It will be giving you some idea. It will ease your work.
Can you spell Elicit?
ELICIT.
Okay.
Elicit.
Doctor, another title is Water Management Strategies for a Growing Population in the UAE.
No.
Optimizing water management for the UAE's expanding population.
You can use the word optimizing. That is good.
Okay, optimizing water management for the UAE's expanding population.
No. The word expanding comes as not that much formal. You know, it's indirectly telling this topic is not, just imagine after completing your thesis, you got awarded your PhD. Maybe research team may be accepting your topic, but after some time, whenever you are naming your thesis, people should feel, okay, that should speak everything about your topic. People say navigating the energy transition. What is your research topic? You can talk. My area is energy transition, or navigating energy transition in the Middle East. So the people may be, oh, Middle East, yes, entirely you covered, yeah. That feeling will be there. Or okay, something we should give some impression on the topic. By using the word expanding is not good, but you can use the word optimization. That is really good, Bala. Optimizing or optimization of water management in UAE. Then semicolon, think of something else. Anything you can add it or not. An empirical study, or an empirical study on growing population in UAE or something like that. You just work on it. Obviously, you'll get good one. Okay. The word optimization, I liked it because people are using the optimizing word really good. And this SPI space, you know, SCI space, work on it. You will be getting a very good title also from there. Perfect. So this is all about. And any doubts comes in between, please mail me.
Yeah.
And
SCI, doctor.
sorry.
SCI.
SCI space.
Okay.
Or even you can ask to the ChatGPT for getting a good topic. No problem. Even the DeepSeek is there. You can ask to all these sources, you know, we don't need to copy and paste it. Either we can use it for better results. It will help you. You just give, this is my topic. And can you please paraphrase it? Or can you please give me very good topic out of the available literatures and all? It will give you some good topics from this.
Okay.
You can use it, no problem. So thank you so much for joining, for being active. And I wanted to get the result of you at the earliest possible. I'm working on it. Inshallah. We will do the best. Thank you so much.
Well done.
Bye-bye.
Ramadan Kareem. Thank you.
Ramadan Kareem.